Focus. Ideate. Innovate. Enable.
Hello and welcome to a brand new episode of Live Well with Diabetes. I'm Devina Lasson. Now, over the last few weeks, we've traveled across the country to meet with medical experts to find out everything there is to know about diabetes, the risks, the way in which it impacts your vital organs like your heart and kidneys, and of course, tips to living a healthy life with diabetes. I'm here today in Hyderabad chatting with 3 more doctors to find out a little bit more about diabetes and some of its complications, like retinopathy, neuropathy, and diabetic foot. Joining me on the panel today are Dr. R.K. Sahe. He's the Professor and Head, Department of Endocrinology at the Osmania Medical College and Osmania General Hospital. We have Dr. R.N. Mehrotra. He's the Senior Consultant, Department of Endocrinology and Diabetes, Apollo Hospital, Hyderabad. And Dr. Prasun Deb. He's the Senior Consultant Endocrinologist, KIMS Hospital, Hyderabad. Doctors, welcome. It's a pleasure to have you here today. So, Dr. Sahe, let's start with you. Let's start from the top. What is diabetes exactly? Who is susceptible to it? Can you give us an overview?
There could be different types of diabetes. As we all know, type 2 diabetes is the most commonest type of diabetes. Type 1 diabetes is less common, seen more in young children. And then all of them have a difficulty in their ability to use glucose because of a lack of insulin. It could be either an absolute deficiency of insulin as in type 1 diabetes, or it could be just an impairment in the ability to utilize insulin in type 2 diabetes.
Right.
And this ultimately what happens is that the high glucose has a detrimental effect on some of the tissues where the glucose enters without the need for insulin. And in these tissues, particularly the retina, the kidneys, and in the nerves, there is damage because of this high glucose levels.
Okay. Dr. Mehrotra, Dr. Sahe has just mentioned type 1 and type 2 diabetes. Are there any major distinguishing factors between the two?
Yeah, the type 1 basically occurs more in the younger children, and basically it comes with a lot of symptoms like passing or urine or thirsty, and the sugars are very, very high. Sometimes they have become positive, and the children may be in diabetic coma also. And if you look at the type 2 diabetes, it basically occurs in the elderly population or more like obese population. It's picked up more or less on a routine examination or when the patient goes for surgery. Sometimes they may have high sugar causing symptoms to come.
So what are some of the risks of uncontrolled diabetes, and which organs does that affect?
Type 1 diabetics are seldom asymptomatic. So you really do not have a concept of screening for a type 1 diabetic. You don't need to go out in the population and look for them. But in type 2 diabetes, for a number of years sometimes, a person may not know that he has high sugars, and so there is a role of screening normal asymptomatic individuals to find out whether they have diabetes. A variable amount of years after someone has developed high blood sugars, certain organs start getting affected because of the fact that the blood sugar is high.
Right.
And principally among them are the eyes, the retina of the eyes, where your vision forms, the nerves in the body, and the kidneys. Now, the 3 of them comprise what is called the diabetic triopathy, or the microvascular complications. A majority of type 2 diabetics would not probably be seriously affected or, God forbid, die of microvascular complications. They have more problems with their macrovascular complications like the heart and brain strokes. The microvascular complications, on the other hand, are directly related to high blood sugars. And so, if you control the blood sugars properly, if you pick up your diabetes early and you control them properly, then you can actually prevent these microvascular complications. And that is the reason why there is an importance of screening for asymptomatic type 2 diabetics in the population, because they may not be feeling anything, but the microvascular complications have already started. And so, if you can pick them up early and treat the blood sugars to near normalcy, then you can actually.
At what age would you say this should be done, the screening process?
All right. Internationally, it is said that anyone above 45 years and asymptomatic should be screened.
Okay.
Indians, unfortunately, are already at a high risk.
Right.
And so, in India, probably the age for screening should be much lower.
Dr. Sai, Dr. Deb has just mentioned how eyes can be severely affected in diabetics. Let's talk a little bit about this. What is the disease that is centric around the eyes being affected in diabetics? What are the signs and symptoms?
In the eye, we call it as retinopathy, because it affects the retina, which is the layer of the eye which is light sensitive, which is required for the vision. And here what happens is that the blood vessels which supply the retina get occluded because of diabetes, particularly uncontrolled diabetes. Whenever diabetes is not well controlled, then they tend to have more effect on the retina in terms of causing blockage of these small vessels which supply the eyes.
So is there a certain point at which you would say a diabetic patient is more susceptible or more susceptible to getting diabetic retinopathy?
Well, it's like this, that type 1 diabetics tend to start having these complications. If the diabetes is not well controlled, they tend to start having this after about 5 to 10 years of their diabetes. While type 2 diabetics, because their duration of diabetes, they may have diabetes for a long period of time without knowing about it. So we need to screen them right from the time that they're diagnosed to have diabetes. We screen them at that point of time, and then every year we need to screen them to look for these changes in the retina. Once a person progresses towards advanced diabetic retinopathy, that's when there can be formation of new vessels to take care of this ischemia to the retina, and this new vessels which are formed are very fragile, and they can often break, and there's bleeding into the vitreous, and that causes the loss of
damage.
vision. Loss of vision.
Dr. Deb, would you like to add something to that?
In type 1 diabetes, things are a little more streamlined, and you can actually compartmentalize your patients. Say that, okay, you have diabetes for less than 5 years, there's really no need for you to get an eye checkup done, because it takes at least 5 years for the things to start off. Type 2 diabetes, on the other hand, up to 2% of patients will have these changes at diagnosis. For the simple reason that they might have had it for 5 or 6 years. And so in type 2 diabetes, since they are a heterogeneous group, they just need to get themselves checked once a year. If they are not getting it checked, then as Dr. Rakesh Sahay said, since it is not going to be asymptomatic, we routinely tell our patients to get the eyes checked, and they say that I have no problems. Why do you want me to go to the eye doctor? Or they say that yes, I've got it checked, but what they mean is that they've got their eyesight checked.
Which is not the same.
They need to go to the ophthalmologist who need to dilate the eye and put a light inside to see actually whether the retina is affected.
That's the key point. It's a different process actually. A regular eye checkup and a checkup for diabetic retinopathy is a completely different process.
Absolutely.
Let's talk a little bit about diabetic neuropathy. There's a few types of neuropathy, diabetic neuropathy as well. So can you sort of take us through it and how it impacts different parts of the body?
The microvascular complications, the triopathy, is related to high blood sugars. And so all of these are related to how long you have had the disease and how bad you have had the disease. And so most patients, I'm not saying all, but most patients in their entire career of diabetes will have some amount of nerve involvement. The word neuropathy means, neuro means nerves, pathy means disease, so diseased nerves. And the commonest presentation that these people will have is what is typically called a glove and stocking neuropathy, where the longest nerves of your body, the tips of your hands and the tips of your feet, these are the nerves which have to traverse the longest distance through your body, and they are the most susceptible to diabetic changes. This neuropathy is practically a given. I mean, there will be very few people who will not be affected with.
Is this for type 1 and type 2 diabetes?
Both type 1 and type 2. Since it is related to hyperglycemia, high blood sugars, both type 1 and type 2 will have the same disease. The glove and stocking neuropathy, the commonest one, is probably going to touch most, if not all people. A similar related neuropathy is called autonomic neuropathy, which is also affected in the longest nerves first. And this autonomic neuropathy specifically affects certain organs like the heart and the stomach, and that's a different kind of neuropathy and has to be treated accordingly. The other neuropathies, the mononeuropathies are when one single nerve of the body is affected. For example, there are certain cranial nerves which come directly out of the brain and does one specific thing in the body. Those kind of neuropathies are called mononeuropathies. Again, fairly common in diabetics, but it's not related to the duration or the duration or the severity of the disease. Also, mononeuropathies tend to go away. There are specific treatments that you have for mononeuropathies, and you can actually treat them. There are other neuropathies which affect only the muscles, the motor actions of the body, like diabetic amyotrophy. These also have fairly specific treatment. The last kind of neuropathy is related to the treatment. There are some kinds of neuropathy which can actually happen when you are bringing down the sugars suddenly.
Yeah.
If someone comes to you with sugars of 500, 600 and the doctor gives him insulin, the sugar suddenly drop to 150 and he has this really painful neuropathies in the feet.
Okay.
Nothing to worry. This is a temporary neuropathy. It goes away. It is only the body trying to adjust to the normal
Right.
values. It might take a couple of weeks and it can be very excruciating couple of weeks, but it's not something that will last for a long
Right.
time.
Okay. So, Dr. Sahe, tell us in that case, what are some of the risk factors of diabetic neuropathy? And as Dr. Deb mentioned, there are several types. So, are there different risk factors for the different types as well?
Well, most of the types of neuropathy have similar risk factors, particularly the glove and stocking type of sensory motor neuropathy, which is speaking about, or the autonomic neuropathy. It's related to the duration of diabetes, and then that's one of the major factors. The other factor being the type of control that a person is maintaining, the glucose control that the person is maintaining. If the glucose levels are higher, then they are at higher risk of having neuropathy. But if they are able to maintain their glucose levels within the normal range, then they are protected from the neuropathy. So that is one of the major factors, the degree of glucose control that the person is able to maintain. That's the major factor. Then apart from that, the other factors, as we discussed about, their genetic factors, like some people are more prone to neuropathy, some people are less prone to neuropathy. As Dr. Prasundev just mentioned, that there are people who are worried that they have been maintaining their diabetes well, but still they have developed the neuropathy. So such people are, there are these genetic factors also. Then apart from that, lipid control, the blood pressure may not have as much effect as in the retinopathy or the nephropathy, but that is also one factor. And then certain other factors like alcohol intake has an effect on the neuropathy.
Yeah.
And so that's
so lifestyle factors play a role as well.
These are probably the factors which influence the development of diabetic.
Okay. Dr. Malhotra, in that, let's talk very importantly about the symptoms. And also, what are some of the complications, the possible complications in each case?
As you look at the total body, every part of the body has got some nerve supply. So whichever the nerve supply is getting damaged will produce symptoms. I've been told that with glove and stocking neuropathy is the commonest neuropathy. So there the patient will have feeling of pain and burning pain in the hand and the feet. Sometimes there will be a loss of sensation. That's a very important part. You may get an injury, but you may not feel the pain of the injury. That's very important. We have talked walking on walking on the ground, you may not feel the ground properly. You may have an imbalance. You may fall with that. Very important part. Then comes the complication like diabetic amyotrophy. Amyotrophy will cause the weakness in the limbs. You may not be able to walk, you may not be able to lift your legs. Then comes the autonomic neuropathy. Neuropathy involving the heart will lead to sudden arrhythmia. Heartbeat will not be regular. It may lead to more heart rate. And sometimes it can even cause cardiac arrest. It's a very important patient going for surgery. Somebody having neuropathy will lead to sometimes very bad complications. It's very important, the symptom is the constipation. Very, very common symptom of neuropathy is the constipation.
Okay.
Or they may have alternate diarrhea. So very distressing to treat. Sometimes patient may say for some time I have got a lot of diarrhea, what medicine I take, and then again he has got a constipation.
Okay. But let's talk about some of the more serious complications. Can you point out some of them?
The very serious complications of the diabetic foot are very important. Like we say, there's a lot of sensation in the foot. Then comes your cardiac abnormalities. These are very, very important. The rhythm abnormalities. We have one cardiovascular disease, which is because of heart blockage, because of blood vessel blockage. But this is because of your nerve damage causing the rhythm problem. Very important.
And silent myocardial infarctions are also very common in diabetes because of autonomic neuropathy. They don't perceive the pain.
What are some of the treatment processes? How would you treat some of the problems of diabetic neuropathy? And also, what are some of the precautions that you would recommend to patients who are already suffering from the problem?
Prevention is much easier than treatment for neuropathy.
Yeah.
And the prevention is pretty simple, as pointed out, because it is related to the high blood sugars. Control the sugars, control your lifestyle. If you have a cholesterol abnormality, you need to control that. If you are a smoker or an alcoholic, you need to cut down, or even better, quit. And this will at least postpone sometimes indefinitely, the onset of neuropathy. But the vast majority of patients who have peripheral neuropathy, that is the glove and stocking type of neuropathy, they can only be treated for their symptoms. And so if they have a burning sensation of the feet or pins and needles kind of sensation, these sensations can be treated. There are good medicines for that. Along with the sugar control, you can have treatment for these sensations. And so then, if someone has a disease which is advanced enough so that he cannot feel his feet, then he needs to do certain specific foot-related precautions.
Okay, yeah. Dr. Sahi, we've spoken extensively then about how the foot can be affected in patients of diabetes. Let's talk a little bit about this. What is diabetic foot exactly?
There is neuropathy, there is loss of sensation. The sensation is protective. It prevents ulcer, it prevents injuries to the foot. It prevents damage when you're exposed to hot surface. And so all these protective sensation is lost in a person who's got neuropathy. So that's one major factor that is contributing to diabetic foot. The other factor is the blood circulation. So diabetics tend to have their blood vessels getting affected, their blood vessels getting clogged because of the diabetes itself, and that leads to defective circulation to some parts of the foot.
Right.
And this added on to the loss of sensation makes the foot more vulnerable to injuries and to developing ulcers.
Yeah.
And then the two other factors are that there is, because of diabetes itself, particularly when diabetes is not controlled well, there is more susceptibility to infections, and these infections don't heal well, and that is one more reason that adds on to this other two factors.
But the condition of diabetic foot is curable, is it?
Yeah, I mean, if provided you identify it early, don't neglect it. In some situations where it's neglected for a sufficient period of time, can lead to amputations.
Proper footwear, that's very, very important. Particularly one thing is to choose a comfortable footwear.
Yep.
Never choose high heel or never use a very narrow kind of shoes normally people wear these.
Yeah.
Use a footwear which is very broad, which is very comfortable, which is very airy. Your toes should be able to move around in the, some patients have deformity, they should go for a customized footwear. Go to a shop, they walk on a kind of sensor pad, which stays where the pressure area is, and they will customize the footwear and give it to you.
The diabetic footwear has got this different material on which the foot rests, which does not take the shape of the foot.
Right.
So when he takes it off, it again goes back to a flat surface.
Okay.
And this actually helps in redistribution of the pressure points.
And Dr. Finally, are there any quick tips that you can recommend for patients of diabetes who don't have diabetic foot as yet, so that they can prevent it altogether and they will not be at risk of getting it?
Yes. Take care of your disease. Do not smoke. Consume alcohol as less as possible. Wear socks which are fresh. You need to have cotton socks and not synthetic socks. Small things. It might not sound very important, but these, once you start doing it, you do it reflexly. You just, feel inside your shoe before wearing it without even thinking about it. And these are all good practices.
Yeah. Okay, doctors, thank you so much. These are very useful tips, I think, to all our viewers. Something very relatable that people can easily take care of themselves and therefore prevent some major complications in the future. On a closing note, if all of you can just tell us one tip of living well with diabetes, what can people do to live well with diabetes?
I would say eat right, exercise regularly, follow your doctor's advice, and I think you can live well with diabetes.
Dr. Malhotra?
I would say to monitor the blood sugar via glucometer, use it very carefully, use it to your blood sugar, and check for the complications at least once in a year.
That's it.
I tell my patients that there is no such thing as a good or bad diabetes doctor. There are only good and bad diabetes patients. The instructions remain the same.
Yeah.
The medicines remain practically the same. All you need to do is follow the advices regularly.
Yeah.
It's more of a list of things to do rather than things to don't. The don'ts are not very important.
Right.
The do's are much more important. And just follow the instruction. Find your doctor, stick with him, and just follow his advice. And I think you're all safe.
Okay. Fantastic. Thank you so much, doctors. Thank you for being with us today.
Thank you.
Thank you.
Well, on that note, that's all we have for you on this episode of Live Well with Diabetes. But stay tuned to the channel as we continue the conversation with medical experts to get more information on the risks, treatments, and living well with diabetes. Until then, from the entire team, many thanks for watching.
enable